can't do that. You can't. Yeah, they don't have enough like flexibility in the hip. They might also not have enough flexibility of the knee, you know, a combination. And when you try to do this, like this is the farthest they can go, you know. And I mean, you can like to a limited extent do this, but usually if they're that bound up, then it's not a good idea to go through with this this kind of a stretch. So in the other direction, you know, same thing. And I'm sorry. Okay. So cross. You can also, you know, experiment with different height. Like if patients are more flexible, you can like lift this higher, you know, up and do the same thing. You know, but usually we stay about here with. Yeah. And let's go across this way. Sometimes if they're really flexible and you feel like you're overreaching, you can kind of change your hand position again. And then if I wanted to accentuate more spiral, I usually cross my hands because I don't know, it seems easier. And I want to go more in spiral orientation. Okay. So when you're supine, that's probably the easiest way to do an oblique stretch for the back. I mean, it is possible to use the shoulder lever, but it's kind of awkward for one thing, and I don't know, it's just not as effective. Okay, I'm gonna have you lie face down. Okay, so. Here again, we tend to use the lower levers, so the hip joint, as opposed to the upper levers, the shoulder. Okay, let's see. Can I have you move a little bit over to the left, like more on the center of the gap?
Oh, saving room for you.
Okay. Okay, so if I wanted to do this kind of stretch. Some of these are, you know, physically challenging, by the way. What I can do is, with my right hand, I'm like cradling her knee joint, okay, this way. With my left hand, I'm pressing full palm on the, you know, to the right of the spine there. Okay?
Lumbar.
Yeah, the lumbar area. And first I lift the right leg, and then I kind of pull it towards me, and at the same time, this left hand is pushing against the back this way. So this is again, it's like a push and pull thing. And then I can do this further up the back this way.
So your left hand is doing the an.
Yeah. While the right hand is pulling. It might be hard to think of pulling in the same sense that, you know, we did the limbs, because, you know, with the limbs it's more like we're pulling along the length of the body, but this is like pulling, I don't know, like oblique to the body or something. But it's the same general thing in the sense that we're pulling a part of the body towards ourselves. Okay. If we wanted to use the shoulder, okay, let me have this arm pulled down this way. This is better if you're like, if you wanted to work into the upper back or between the shoulder blades or something like that. Okay, I put one hand like under her shoulder joint this way, and like say I wanted to really put focus pressure between the shoulder blades, or I wanted to knead between the shoulder blades this way. I could use my thumb here, and I could pull the shoulder up. Oh, I'm sorry. Going. I know it's kind of tight here, but I can pull the shoulder up as I apply pressure this way. I'm going to have you lie on your side now. Okay? Now, when you have the patient lie on their side, that's when you can really take advantage of these oblique stretches, because I'll show what I mean. When you're lying face down or face up, the only thing you can do is pull one corner back towards yourself or something like that. You can, like if you can lift the leg up or whatever, but you can't push the opposite, push into the surface of the table. But when the patient is lying on their side, you can have this corner go back and this corner go forward at the same time. So that really accentuates that twist. Okay, so let's see. One example is, we could have the top leg here, her right leg, bent at the knee here. So this leg is, or actually, if you bend it too high, I think it might, yeah. So this corner is kind of going forward this way, right? And then we could, so we could push this, the hip forward this way, and at the same time, what we can do is pull the shoulder lever back, so we can go like this. We can also, if they're flexible enough, have them open. Maybe we could have this arm like this way, and then we just like wrap around the front of the shoulder joint. Okay. And we push on the hip lever, and we pull on the shoulder lever this way. Okay. Sorry. Is that okay? Okay. If you want to be more specific, this hand can also push on the, any tight area of the back here. But it's a combination of push and pull. My right hand is pushing, my left hand is pulling this way. There are even another way you can do this is the opposite, where you have this hip lever go backward. So we'll have this leg bend at the knee this way. This leg is going to just kind of hang back, even over the edge of the table here. So this lever is going back, and then we want to do the opposite with this one. So we're going to push this one forward. So yeah, you can have this arm kind of reach upward over the end of the table. Usually I like to cross my hands here. So my right hand here is going to push her shoulder lever forward, while my left hand is kind of pulling the leg backward this way. You can also do more this way. Let's see. Okay. How are you doing?
Good.
Okay. I know this is kind of an extreme looking stretch. Okay. Okay, but the principle is really simple. Yeah, you're just again, think of it as like the back is a rectangle, and you're working via the corners to accomplish your stretch.
So where are the corners? The two shoulders?
This is, yeah, these two shoulders are the two corners, and the hip basically. So in the sideline position, for example, either you're making hip go back and shoulder go forward, or you're making the shoulder go back and the hip go forward this way. Okay, that's probably the simplest way to think about these oblique stretches.
It's like Andy, it's like you're wringing a rag.
Yeah.
But you had a little pull when you wring instead of this way. The rag is just turn this way. Yeah.
Yeah.
I feel like a rag when you're working. I mean, like you wring a rag. Done?
Yeah.
All right.
Okay.